And here we go with some motion. Look at the top. An extension is when your head is moving backwards. If it goes even further, it's called hyperextension. When your neck looks down at the ground, it's called neck flexion. Same thing at the elbow. Look at the arm. When you do a biceps curl, that means when the wrist comes towards your chest, that is flexion. When your wrist gets away and goes towards your feet, that is called extension of the elbow. Same thing with the hip joint. Hip flexion is when it moves forward, and hip extension is when your feet go beyond your gluteus or your butt. At the wrist joint, you can see the same thing. Flexion is when the wrist allows your fingers to go towards the anterior part. Extension is when your fingers move behind the wrist joint. As we talked briefly about movements in the beginning of the school year, you may remember what abduction and adduction is. Abduct with a B means to take away or movement away from the midline of the body. When someone gets kidnapped, they are abducted, meaning taken away. Adduction, that means you're going to add. So that means it's any movement that comes towards the midline of the body. Your hands, when they move towards your hip, you're adding your hands to your hip. It is called adduction. Here we go. In this picture, abduction is movement of the hand away from the midline. Adduction is movement towards the midline of the hips. Same thing with your leg. When you abduct your leg, it's almost like a ballet dancer doing their stretches or leg lifts. When your leg comes back to the inside of the body, it is adduction. Same thing can be said of your wrist. When your thumb moves laterally in the anatomical position, that's abduction. When it moves medially, it is called adduction. Adduction of the fingers is on the left, meaning the fingers are closed. Abduction on the right, you have your fingers and thumbs wide open. Circumduction is movement that basically doesn't require rotation, but it's an angular motion at the top. This is a good picture. The shoulder doing a circumduction of a 360. Other types of rotation basically is direction of rotation from the anatomy of the body. This can be basically left or right. Body motions can occur medially or laterally. What does that mean? It means this. When you rotate your head, the C1 and C2, or the two cervical vertebrae, allow you to look right and look left, as you see here. Lateral or external rotation of the shoulder and the elbow joint is when the hand leaves the stomach area. Medial or internal rotation is when the hand goes towards the stomach. This is more of an open elbow. A lot of the medial and lateral rotation in the medical world is when the elbow is at 90 degrees, like when someone's wearing a sling. Pronation and supination. Pronate rotates your forearm, and that's when your radius is over the ulna. Supination is when the forearm is in an anatomical position. Let's make this clear. When you supinate, the two letters UP is in supinate, so your palm is facing up. This is when a child asks his mom or dad for money or allowance. Pronation is when you're laying prone in the bed, your face is down, so now your wrist is prone, meaning the wrist or the palm is facing down to the ground. And that's what pronation means. Here's the picture. On the left, supination, the hand is shown palm up, perhaps for a handshake or asking a tip from a waiter. Pronation is when the hands are down and you see the back of the palm. That is when your fingers and your palm are facing downwards. Look at the picture on the right and you can see when pronation occurs, it is your radius crossing the ulna and you have the letter X. When you are in anatomical position, the radius and the ulna are parallel and they look like the number 11. Other movements include inversion, which is basically twisting the sole of the foot medially, eversion, twisting the sole of the foot laterally, And keep in mind, evert in this case is exiting. So that would be laterally. In, you will remember that you'll always go medially. You're going inside the foot. Dorsiflexion. Dorsal means the back of. So dorsiflexion is basically when you're tapping your foot up. So your toes are off the ground. Plantar flexion is the opposite. Now you're going to tap your foot down. In other words, someone who likes to race cars has a lead foot. Well, they definitely enjoy plantar flexion. Eversion on the left and inversion on the right. When people sprain their ankles, it's usually inversion on the right. That's when your leg, or ankle, basically twists. Here's dorsiflexion, toes up. Plantar flexion, toes down. Opposition is when the thumb moves towards your fingers. We, along with the primates, the chimpanzees, monkeys, are able to do that with our thumbs. Reposition is the opposite of opposition, is moving your thumbs away from the fingers. Protraction moves in an anterior horizontal direction. Retraction is the opposite of protraction. It moves anteriorly, pulling up in a vertical. Here's opposition when the thumb is touching the fingers, and dear God, that person needs to cut their fingernails. Retraction is when your body moves backwards, posterior. Protraction is when your body joint moves forward. Elevation moves in a superior direction, like an elevator going up. Depression moves directionally downwards, like going down. Lateral flexion bends the column of the spine from side to side. So here, depression is the jaw going down. Elevation, the jaw is closed. Lateral flexion of the spine is when your neck and your head move side to side. Classification of synovial joints by shape: gliding, hinge, pivot, condylar, saddle, ball, and socket. A gliding joint is a flat or slightly curved surface. It's not that much of a motion joint. It's a little bit limited. Hinge joints are angular motions in a single plane. A great example of a hinge joint is your elbow. Pivot joints, rotation only occurs here. Here's an example of a gliding joint. It's where your collarbone meets the manubrium of the sternum. The hinge joint, as I said earlier, would be your elbow, knee, or ankle joints, where you do have flexion extension. A pivot joint is when you can move left or right, and a great example is the C1 and C2, or your neck. Condylar joints are oval with a depression in the joint. Motion occurs in two places. Saddle joints have two directions. Ball and socket joints, however, can actually move in the most range of motion possible. A ball and socket joint would be your shoulder. Here's a condylar joint. It is your carpal or your wrist bones. The saddle joint would be your metacarpals of your hands. And the ball and socket joint, which only the true one in the body, is your shoulder joint right here. Joints. A joint cannot be both mobile and strong. As I said earlier, the greater the mobility, the weaker the joint becomes. Baseball pitchers are prone to tearing up their arms, and they really don't have a long career in the sport. Mobile joints are supported by muscles and ligaments, not bone-to-bone connections. An example of that is your knee. Your knee joint is so valuable to your body in motion, and it's important to know the only things that hold it together are the quadriceps, the hamstrings, and the muscles and tendons and the ligaments in that joint. The intervertebral disc, we said earlier, were the pads of fibrocartilage that are in between your vertebrae. As you see this picture here, they are located in between the body of the vertebrae, and your spine does absorb a lot of it. Think of these as the meniscus of the knee, but there's multiple discs in between the 33 overall spines. A slip disc is an injury when you bulge in the annulus fibrosus and invades the vertebral canal. Basically, the disc is pinched, squished, and you could possibly leak fluid, which is very painful. Number 2, a herniated disc is when the actual nucleus breaks through the fibrous and is pressing on a spinal cord or nerve. Now this is causing like a sciatic pain, like an electrical shock or a knife stabbing injury. If you look at this, this is a example of a slip disc. It's bulging out and the actual fluid is being pressed out. The vertebral column, your spine, can do the following movements. It can flex, extend, flex laterally, and rotate. The shoulder joint is known as the glenohumeral joint. Allows more motion than any other joint. Remember this, the shoulder joint is the most moving joint of the body. Therefore, it is the least stable and the one to possibly have the most injuries. Supported by the muscles, tendons, and ligaments. It is a ball and socket joint, and it's located between your humerus and the glenoid cavity of the scapula. Again, the glenoid labrum is a deepened socket of fluid or fibrocartilage tissue. It is like the meniscus is to the knee, the labrum is to the shoulder. It is a fibrocartilage material and it extends past the bone. The acromion process, or the clavicle of the scapula, they help to project laterally to hold the humerus or the arm in place. The ligaments of the shoulder include the major 5 that are in front of you: glenohumeral, coracohumeral, coracoacromial, coracoclavicular, acromioclavicular as well. The shoulder separation is an injury in which you have a dislocation of the shoulder joint due to tearing or stretching of any of these ligaments.